Good evening. My name is Marquez Ronnie. I'm one of the nurses here at South Georgia Medical Center. Also a senior nursing student at Columbus State University. My capstone project for my final exam will be preventing central line associated infections in the acute care setting. As you can see, the picture says keep calm and prevent Clabsi's. Here among us are my peers, Jennifer White, one of the charge nurses here. Charlene is the Clabsi coordinator here at South Georgia Medical Center for the intensive care department. Siobhan Jones and Miss Sandra Tooley are two of the senior staff nurses here. Very, very good resources all together as far as preventing Clabsi's in our facility. So the abstract is basically a brief summary of what we're going to talk about for this presentation. So holistically, hospital-acquired infections, they do attribute to an increased amount of unnecessary costs in our healthcare system, which is also can put a strain on the resources that we have for healthcare. Of the different types of hospital-acquired infections, I'm going to talk about central line associated infections. And here's a fun fact. The occurrence of central line associated infections contribute to an increased length of hospital stay, inpatient hospital costs, and an increased patient morbidity and mortality. So the introduction, here are some important facts. So first fact, central line associated infections, also known as Clabsi's, are defined as a bloodstream infection that are not related to an infection at a different site, where the central line was placed within a 48-hour period of the development of the bloodstream infection. This is from Haddadin and Reagan News, an article that they wrote in 2017. It is estimated that 30,100 Clabsi's occur in the United States in the intensive care setting each year. Patient mortality rates associated with Clabsi's range from 12 to 25% annually, which is a good bit when you calculate how many people in the world actually get central lines that are inserted and how many that actually get Clabsi's. That's a pretty big number. The cost of treatment for Clabsi's per episode range from $3,700 to $36,000, which in most cases the facility has to pay for if the Clabsi is like caused from like improper technique or something that's the facility's fault. They have to pay for that on top of the patient's admission, which if you calculate that over several patients, over several weeks, over several months, that's a lot of strain from the healthcare industry as far as that facility, and that money could be placed into different places. So we want to try to prevent central line associated infections. Next slide. So some statistics. According to the Association for the Professionals in Infection Control and Epidemiology, central line associated infections were associated with the highest number of preventable deaths among healthcare associated deaths. It was estimated that 5,520 to 20,239 lives would have been saved annually with best practice implementation. And here's like a chart that you'll see. It kind of says central venous catheters are the most frequent cause of healthcare associated bloodstream infections. Greater Clabsi risk is developing in the countries. In the countries, the rates of healthcare-associated infections related to the devices, in most cases, are 3 to 5 times greater. 25,000 Clabsis occur in the United States each year, 80,000 in the intensive care unit. As that we're all ICU nurses, this really affects us because most of our patients that are here long-term require central venous access. In most cases, are going to be central lines, so that's pretty significant for us. So what is a central line? You know, we've been throwing out Clabsi's and the cost and how it affects us, but we got to start with the basis. You know, what is a central line? Many people don't know what a central line is, especially people who don't have to care for a central line or take care of patients that have a central line. So what is a central line? A central line is a form of intravenous access used for blood drawing, renal replacement therapy, administering medications, and IV fluids. Central lines can only be inserted by an advanced medical provider, such as a doctor or a mid-level practitioner. Central lines should be inserted under strict sterile technique. Notice I said should be. Are they always? Sometimes not, but usually they should be. Central lines are usually inserted into the neck, the chest wall, the upper arm, or the groin area. And here at this bottom picture, it'll show you where the different landmarks on the chest where the central line may be inserted. So, indications and contraindications. So, sometimes you'll have a patient who may really need a central line, but they may not necessarily meet the criteria for a central line, or vice versa. They may not meet the criteria for a central line, but they really need one for poor vascular access. They may be a renal patient with no veins, all that different kind of stuff. So you kind of have to balance, risk versus benefit on behalf of the patient. So indications. So we use central lines a lot for volume replacement, IV fluids, bolus therapy. Sometimes we'll use it for infusing blood products. We use it for nutritional support. Some patients, especially our GI surgery patients, will require TPN, which can only be given through a central line. Sometimes we give caustic medications like electrolytes, can be very caustic to the veins. Some of our different antibiotics are very caustic to the veins. For patients who are receive chemotherapy, sometimes they'll have a life port, which is a type of central venous catheter because chemotherapy is very caustic to the veins. We use them a lot for hemodynamic monitoring for CVPs. Sometimes, depending on the type of PA catheter they insert, it's similar to a central line, so we use that as well. Renal replacement therapy for our dialysis catheters, temporary and permanent dialysis catheters. And routine blood drawing, it keeps you from having to stick the patient so many times, especially if they have poor vein access. So contraindications, so with everything we do, there's always a risk or a negative outcome associated with it. So contraindication would be obstruction of the vein. They may hit the vessel, but they may puncture it, which will cause a lot of bleeding. Sometimes that vessel will become stenosed if the patient requires a lot of central venous catheters over a long period of time. Sometimes, especially if the catheter is inserted in the neck, it can cause increased intracranial pressure, which can affect the patient neurologically. Coagulopathies, of course, the patient could have increased bleeding at the site. It could form a hematoma. They could, form a clot there. So we have to keep a close eye on that. Site contamination, of course, which is why aseptic technique is very, very important. Of course, you can cause trauma to the desired site and thrombolysis as well. This information was obtained from webmd.com. So the objectives for the project. So the main objective for this project is to spread awareness regarding the existence of central line associated infections while concurrently providing prevention strategies deemed favorable in the management of central venous catheters. The second objective, another objective would be monitoring and surveillance. A key way to monitor the efficacy would be to identify the problem, implement change, and measure the effectiveness of the change model geared towards prevention. The last objective would be the use of core measures. We use core measures a lot to help us come up with a plan, a generic plan, usually patient specific, but fairly generic in how we care for our patients, what is deemed appropriate as far as evidence-based practice, models we use as a guide to care for our patients to prevent increased hospital costs, to prevent lengthy hospital stays, to prevent readmissions. And so central line management is a part of one of the core measures we have here on the inpatient setting. This can include a care model that reflects a need for preventing the occurrence of central line infections that allow the nurse and the healthcare team to promote wellness and decrease overall hospital costs. So the rationale for this project, so in everything that I've said so far, the rationale for this project and everything moving forward from this will encompass providing information that regards ways to prevent central line infections. I'll provide rationales to why central line associated infections are important, implement core measures that are deemed favorable in managing patients with central venous access. I'll explain how decreasing the amount of central line associated infections improve the financial strain on healthcare. I'll explain how preventing central line associated infections also improve patient outcomes. So here are some demographics. I'm not going to read all this because it's a bit much, but this kind of shows you, roughly an estimate of how much the central line associated infections weigh heavily on our government as far as healthcare costs. It kind of shows you some statistics and flow charts of occurrences of central line associated infections and the cost here. It's saying a cost of avoidance is roughly $36,000 dollars per Clabsi event, which is a good bit when you calculate 2 or 3 Clabsis over a couple weeks. I mean, that gets up into the 100,000s or more. So that's a good bit of money that could be saved with, you know, interventions to help prevent. And the chart on the end is kind of some mortality rates and how we go from having a patient that is well, they get a central line, it gets infected, they get septic, and then sometimes they die, unfortunately. So this is kind of a chart explaining all that.
Can I ask you a question?
Yes,
Are
ma'am.
we gonna ask questions at the, maybe this is what it is, ask questions at the end?
Yes, ma'am. Or if there's a question you have during the presentation, feel free to stop me. We'll talk it out, and then if I don't cover it in that slide, it may be on the next slide,
Okay.
but feel free to ask any questions. So the PICO question for this project: does the use of prevention bundles for central line associated infections help decrease the number of occurrences and reoccurrence of central line associated infections in the inpatient setting? Next slide, please. The findings for this study concluded that 388 children that were enrolled in the study showed a surveillance of 7,783 catheter observation days. The underlying conditions marked 34.8% medical, which may include patients that require rapid intravenous therapy, vasopressor therapy. Oncological patients would be patients that may receive chemo. 29.9 would be patients that were surgical, requiring blood products. They may require TPN if they were having abdominal surgery, those type of things. During that study, there were 29 episodes of Clabsi's in 26 patients. So that means at least every patient had a Clabsi, if not more than one. The findings for this study were strategically formulated to explain the prevalence of central line associated infections, focusing on ill populations specifically. The purpose of this study was to deliver preventative surveillance information regarding central line associated infections. Next slide. So this slide we have here is evidence for change for the second source. This source was comprised of different members of the healthcare team, anesthesiologists, surgeons, nurse anesthetists, primary care nurses, all came together and came up with what they call the Bundle Plus. This study was observational in nature, as it was designed to explain how central venous catheter prevention can be observed within 8 intensive care settings within a tertiary hospital. The basis of this study included prevention bundles that included hand hygiene, educational services, chlorhexidine skin preps, anti-infective catheters, and the daily need for the assessment of central venous catheters. The result concluded with a 92% reduction in Clabsis, which basically means out of everybody in the study, 92% of those were reduced in the amount of Clabsis. That's a pretty remarkable number given that the Clabsi rate is so high. Central venous catheter use decreased between 2008 to 2012. The findings were formulated to explain how bundles for prevention are used in the overall prevention of central venous catheter associated infection. The article also explains how the behavior, which is among staff, was seen as an important factor of central line associated infections. Next slide. So the third source, so this particular source took place in Europe. It was among some intensive care units in Europe, and this group of physicians, most of them are MDs currently practicing. Some of them are retired and just do this for educational purposes. But this took place, this was a randomized multi-centered study to show how important it is to reduce central venous access catheter bloodstream infection. So this study was randomized. It was a controlled study that took place among 14 hospitals in 11 European countries. So it's about roughly a hospital a country. The purpose of this study was to explain how strategic central line insertion and hand hygiene improvement aids in preventing central line associated infections. So, you know, everything we do in healthcare always kind of leads back to the foundation, hand hygiene. You know, are you washing your hands? Are you gelling in and out? You know, hand hygiene is important in whatever you do, not just central line management, but any type of direct patient care, you know, hand hygiene, gel in, gel out. You know, you have these posters everywhere. Are your hands clean? You know, there's a sign we have, you know, did your nurse wash their hands? Did your nurse gel in? Did they gel out? So all those kind of campaigns are all important in promoting why important it is to, you know, do hand hygiene, as it is important in managing central lines. So the results of this study concluded the PROHIBIT model, which is prevention of hospital-acquired bloodstream infections. It was a mechanism that was effective in decreasing the incidence of central line associated infections. So staff compliance with central line associated infection prevention measures increased from 10% to a baseline of 70%. I thought that was a very remarkable amount, because basically that means none of your people are doing it to most of your people are doing it. So that was pretty significant. Then this was during the intervention stage. So hand hygiene compliance increased from 48 to 52%. Doesn't seem very significant. It's only 3%. It's only 4%, sorry. But it's an increase, so that means the information that's being provided is important. It's getting out there. Now, what are we going to do with this? Pretty much what that study was about. So with the decrease in the incidence of central line associated infections, there was an increase in hand hygiene compliance. So,
Next one, please. Hold on just a second.
yes, ma'am.
I'm pretty sure it's already. I should go back.
Okay, great.
So I'm gonna say that. Sorry. No, it's okay.
So recommendations for this care model that I put together. The use of appropriate quality prevention measures such as meticulous hand hygiene, educational forums to ensure compliance, routine assessments of central line site and necessity, dressing changes every 7 days as needed, antimicrobial scrubs for the ports all help create a safe, cost-effective environment for our patient. This is pretty much what we use for managing patients with central lines. You know, we, of course, hand hygiene, we give the patient information. Of course, it's on the care plan, it's on the patient information tab. We change the dressing every 7 days or as needed if it's soiled or detached from the skin. We use the antimicrobial scrubs, the chlorhexidine, scrub the hilltops. We use those on free ports that aren't infusing. And they do help create a safe, cost-effective environment. Since we do all of this, we are able to increase staff awareness regarding central line management. Also, we provide education materials as project reinforcement. You know, like I said earlier, sometimes people don't know, you know, newer people or people who may not be used to central lines back here in this setting. You know, we get people sometimes that are pulled from different departments who may not be very familiar with central lines, you know, so definitely using educational material is very, you know, important in getting that information out there. When we do have patients that get central line associated infections, of course we collaborate with, you know, the infection prevention team, you know, come up with a plan, you know, kind of have our surveillance, you know, to watch, you know, well, the patient had it at this day, they've gotten this course of treatment, we removed the line, we've cultured it, we've inserted a different line. So they definitely are very good with partnering with us with doing all that type of stuff as far as taking care of the patient. And in that, we formulate a team of multidisciplinary professionals to help design interventions and monitor surveillance, in which we do have a Clabsi team here. As I mentioned earlier, Ms. Charlene Schultz is the director of that. She does a very good job in monitoring and surveillance and getting information to the staff. We do it at our annual skills lab, all that kind of stuff, just getting awareness out there and preventing Clabsies, because they do weigh heavily on our healthcare. So for this slide, this is the evaluation stage. I'm not gonna really go over all of this, just gonna hit two high points and then we'll move on. So most of the problems that stem from central line associated infections are related to the dressing. So very important to make sure that tip of the catheter is covered with a occlusive dressing at all times. Using the chlorhexidine swabs, evidence-based practice shows that chlorhexidine scrubs have been shown to decrease pathogen formation at the port. So we use those scrub the hubs. They're orange. We put those on all the free ports that aren't being used on central lines. Of course, assessments. We assess the central lines every 2 hours. Make sure that the central line is intact. Make sure the sutures are intact. Of course, we document on them. We make sure the bio patch is present as it is also dipped in chlorhexidine. And anytime we notice a change or redness at the site, we report it to the physician. So that's kind of the gist of what we do in the evaluation stage. More evaluation. So of course we use surveillance to monitor the trends of Clabsi. Educational modalities will be implemented for our target audience to whom central line associated infections directly impact mostly the primary nurse. Outcome evaluation, we can monitor outcomes weekly, monthly, quarterly, and even annually. And we'll track the tubes to help tabulate the amount of central line associated infections. Routine, quarterly, and annual skills lab checkoffs for nursing staff to ensure competency for the assessment and management of central lines. And that's actually something we just started with our annual skills lab, is a workstation for central line management. So this slide is going to talk about the outcomes from the project after all of the information that has been given. The first outcome is to raise awareness regarding central line associated infections. The second one is to raise awareness in decreasing the incidence of central line associated infections. And on the contrast side, we want to increase the staff awareness of preventative measures to ensure increase hand washing compliance, and all of that will help increase our central venous access compliance among staff members, among patients, among the facility as a whole. Next slide. So my conclusion, every day, every hour, every minute, every second, there is a change in healthcare. It's a constant variable. The mentality, this is how we do it, this is how it's always done, makes it very, very difficult for us to implement change. Of course, it is inevitable, but it doesn't happen overnight. With effective educational modalities, staff compliance, and collaborative efforts, we can help decrease and furthermore prevent the existence of central line infections. The information in this capstone is a great start to creating a safer, infection-free environment for our patients. As nurses, we're expected to make clinical decisions that directly impact patient care and their needs. Even if I'm only to be able to make a change in life for one patient, I'm satisfied. Nursing is a way of life. It is who I am and what I choose to be. Next slide. Questions? Are there any questions?
You did an amazing job, and pretty
Ms.
much
Julie,
covered
you have any
it.
Yeah, there's a question I do want to ask, and I was just wondering, sometimes did you get an information when you was looking at that, like with the age, the elderly people, sometimes because of their state, or should I say their condition, that they are more, I know they are more prone to getting infections. Did it show that they more so?
There was an article I read that suggested age may be a factor, but it wasn't a significant amount for them to put it in the study. A few people who are elderly, which of course they are more susceptible to infection, but it wasn't strong enough to say this is a definite factor. But they mostly equated to, health status, immunocompromised patients, critically ill patients, surgical patients. They mostly related to what the patient had going on medically. There were some articles that suggested age, but it wasn't anything definite.
Okay. Thank you.
More questions? No more? All right. Next slide. These are my references. The end. Thank you for your time.